Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Using Allied rail systems in Europe, the Army is testing how rail evacuation could expand medical capacity during large-scale conflict. Here with more details on what exactly they're testing in this exercise is Colonel Crystal Belew, commander of the 519th Hospital Center. Colonel Belew, it is so great to have you on the show. Thanks for joining me today.
Thank you so much for having me, man. It's a pleasure to be here.
You are coming to me from Germany, where the U.S. Army Europe is conducting Sword 26 exercises throughout the month of May. Before we get into what your particular role is here, give us an overview of what these exercises are, who's participating, what you're trying to test.
So the Sword 26 exercise is a series that demonstrates the Army's ability to operationalize the Army's transformation initiative. It's through the Eastern Flank Deterrence Initiative concept. It leverages in-theater forces to enhance deterrence and readiness. Specifically at the 519th Hospital Center, we're going to be working to modernize and innovate different levels of medical care and medical evacuation. We're going to be looking to do different types of innovative platforms, casualty staging, and we're going to be participating with different types of NATO allies and partners and different types of units across the theater wide. Yes, ma'am.
One of the things that I think is really different about this is the Army has been practicing contingency operations really for the last 20 years, and this is back to large-scale combat operations. What sort of difference does that make in the work that you do through the 519th Hospital Center?
Yes, so we really need to start focusing on the size and scale of the complexity of the patients that we're going to be having. When we think of the previous COIN operations that we've been operating for a significant amount of time, we had been operating under what had been known as the golden hour, where we had air superiority. We were able to, under rotary wing, evac patients within a very short period of time to get them very rapid medical care. And we were able to maximize logistical and medical resources for those patients with very high successful survivability rates. And as we shift the thinking into large-scale combat operations where airspace is now contested, logistics are now contested, and we are expecting mass casualties, we really have to start innovating our training, modernizing, and our focus on how we're doing patient care and how we're doing evacuation. We have to start preparing to care in a prolonged standardization on the front lines. And we really need to start making sure that we're preparing our soldiers and we're supporting the maneuver forces and how we're clearing the battlefield as well.
Speaking of clearing the battlefield, one of the things you're going to be testing here is rail medical evacuation, something the Army hasn't done in Europe really since World War II. Why is rail evacuation back on the table now?
So two things, scale and efficiency. Trains allow us to move large numbers of patients over long distances in a single lift. This is something that ground and air assets alone cannot sustain in LSCO. They reduce the burden of high demand medevac platforms, and they provide a very reliable option when airspace is contested. In short, they give us the operational depth and flexibility that we're going to need in LSCO.
Is rail evacuation something that you can do anywhere, or is it really unique to operations in Europe?
When you look at the geography in the European theater and the lessons observed in recent conflicts, the rail network is a robust and high capacity lifeline. The medical evacuation train, or utilizing a standardized commercial rail for CASEVAC, allows us to move hundreds of patients in a single lift compared to a handful on a rotary wing aircraft. The rail network within the European theater is a common practice, something very experienced, and provides us a very wide, broad opportunity to also move into a more NATO interoperability dimension as well.
I'm speaking with Colonel Crystal Belew. She's commander of the Army's 519th Hospital Center in the 21st Theater Support Command. So, Colonel Belew, when you think about bringing people out of the theater on rail, what levels of injuries might you be able to transport in this way?
So in this current exercise, we're going to be testing the capabilities of the specific rail platform that we're going to be utilizing in this theater. So more minimal, more ambulatory patients to see how our capabilities can collaborate and coordinate with our NATO allies. But in the future, what the goal would be to outfit these trains to serve as rolling hospitals. They wouldn't be to just move patients. The goal would be to actively provide en route care. The innovation itself isn't just the train, but it's basically a modular life support system that we could plug into standard rail cars. Now, again, this would be the long-term goal, and we're starting at the ground level of where we could experiment and innovate with these platforms. You could do anything from isolate intensive care compartments. You could establish mobile surgical suites. You could move massive volumes of patients from the immediate combat zone to higher echelons of care, all while bypassing that contested airspace. That would be the goal.
That sounds really ambitious. Is that concept in development, the equipment, the practices, all of those kinds of things?
That would be a difficult question for me to ask. I know within the Medical Center of Excellence in San Antonio, Texas, they are actively looking and researching into what the future of that may be. And not something that necessarily that we're looking at developing within the 519th Hospital Center. So we are going to be testing specifically, like I said, the minimal kind of ambulatory patients, but definitely, as you stated, a very ambitious goal that would be the long-term hopes as a provider myself that I would like to see a rail evacuation platform to move to.
Well, let's come back to this exercise itself. You're hoping to move about 250 casualties, stabilized casualties who need higher level care. What are the particular learning objectives that you're trying to test here, and how will you know if you've been successful?
So we've established at the 519th Hospital Center, we've established two key tasks in this very innovative training that we're working to get after. The first is such as to test and develop that concept for the medical train treatment and evacuation. Although we're not aiming to get after specific patient outcomes in this specific training, we are trying to gain lessons learned, and again, evaluating those minimum patients, how we're loading them to the train, the time that it takes, the staging that it requires, the power capabilities, the medical equipment that's required, the personnel support that it requires. So looking a lot more of kind of the logistical aspects behind it. And then the other part to that would be the developing and testing the concept for the casualty staging unit. And with that, that's a piece of doctrine for us that does not exist and is more of a concept for Army medicine. Now, that is a concept that is actively utilized by our NATO partners that we are going to be testing within this specific exercise. And we are driving the concept of looking at what type of medical capabilities that would require, what type of personnel resources we want to put towards it. And so, again, a lot of lessons learned we're going to be using in this innovation. And so our goals, our training objectives are pretty broad for this specific operation. So we can that way we can pull our different lessons learned and then continue to streamline how we want to move forward in refining these different innovations and concepts.
And again, this exercise is happening in Europe, but if you look beyond at the exercise, are there other scenarios, regions, conflicts, types of operations where rail evacuation might become a realistic or even a necessary option for military medicine?
I do see this as a necessary option for military medicine. It would be difficult to say which geographic regions that it could be relevant and fall to. One example that comes to mind of a very high visibility region would be the Indo-Pacific, where obviously rail evacuation would not be relevant. But that is a region where contested airspace is of concern, contested logistics are of concern. But how would evacuation work in that type of region over such broad geographic space where, again, airspace is contested? So I think with the concept of rail evacuation and the capabilities that it offers, the amount of casualties that it can move in a single lift, I think, or of criticality for Army medicine. And I think where the next conflict could take us would determine the relevancy of that type of evacuation platform.
I've been speaking with Colonel Crystal Belew. She's commander of the Army's 519th Hospital Center, 21st Theater Support Command. Colonel Belew, thank you so much for joining me today.
Thank you so much for having me, ma'am.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.